Some of you may remember the incident when Roy of Siegfried and Roy was mauled by one of the tigers. Did they really put a part of his skull in his stomach, and why? Learn about it in this video. Hi, my name is Jeff and I am an occupational therapist. I make occupational therapy content for students and new grads on my blog, social media, podcast, and here on YouTube. Be sure to subscribe to my channel so that you don't miss a single video. Let's get functional. Hours after Roy was attacked by one of the tigers, a part of his skull was placed temporarily in his abdomen. The reason was because they likely performed decompressive hemicraniectomy. Let's review some medical terminology. A craniotomy is a surgical opening of a portion of the skull to gain access to the intracranial structures and replacement of the bone flap. A craniectomy is a surgical removal of a portion of the skull. Use cases for these procedures can be TBI, such as with Roy, cancer, aneurysms, or infection that causes swelling. Remember that the brain is enclosed inside the skull, and increased swelling in such a space can lead to serious symptoms or even death if the pressure is not addressed. So, neurosurgeons go in using very precise instruments to create an opening to the brain to relieve pressure and remove things such as tumors if they're present as well. These openings are usually made as small as possible, but sometimes due to the severity, larger openings may be required, so the skull or bone flap may need to be removed. Sometimes the patient may be awake actually too for part of the procedure when areas are involved such as the critical speech center of the brain. The bone flap may be removed for 6 to 20 weeks to wait for the swelling to go down. These patients will need to likely wear a helmet when mobilizing out of bed for therapies. Pay special attention to the orders, especially when it comes to grooming, bathing, and level of exertion. While the bone flap is out, it is very fragile and can wither and die, so sometimes it can be frozen and placed in storage cryogenically. But this may cause some complications, such as increasing the likelihood of infection or reducing the integrity of the bone flap itself. Roy had what was called autologous bone cranioplasty with subcutaneous preservation in the abdomen. A popular practice is to store the bone flap in the abdomen because it offers a warm environment with a good circulating blood supply that is probably also sterile. With this procedure, it is placed within a subcutaneous pouch between the muscle and fatty layers. When the patient is ready, the bone flap is removed from this temporary location and replaced back in the skull. This has the added advantage of matching aesthetically and reducing the chance of rejection compared to other methods such as custom cranioplasties. In a 2018 study published in the Journal of Neurosurgery, the average cost of the preservation method or autologous cranioplasty was around $1,000 to $3,000. The average cost of a custom synthetic cranioplasty without preserving the bone flap averaged up to $35,000 or more. Interesting, isn't it?